So what are we trying to do?
Mobilize scapula, try to dissociate a little more scapula from the humerus. We have an arthritic shoulder. So again, we're just trying to get a little more better gliding motion of the glenohumeral head and that glenoid of the scapula. So actually the head of the humerus has become more square shaped. So as we first started with Joe, he was limited to about here. So now we can kind of get him up here. And the shoulder blade is sitting much better. You know, before it used to come together like that. So now we're just doing it. So we actually just brace, block that shoulder blade. My thumb's working nice and easy. You okay, Joe?
Yeah.
Come here, shorten the range. There's the shoulder blade. External rotation was really limited. That can work. So Joe's gonna rotate down. Good. Rotation down. I can block him, push down, hold. Good little muscle energy. Push down. Good. Push down. Good.
What's that?
You don't mind if I do a video?
Of me?
Yeah.
No, not at all.
Yeah, your shoulder. And with Giuseppe Palumbo. Second visit of the week. We just had a total shoulder replacement done on June 6th. 5th, June 5th. And again, this is the first week of rehab. We started on Wednesday. Again, we went over some things that are important. The first day to look at: incision. It's not red. It's no swelling. There's no signs of inflammation or infection. We went over protocol. Protocols are important to establish our guidelines. Every doctor is different with their general guidelines, but in this instance, Joe came into therapy very quickly. We're only 2 weeks out of surgery and he's here, whereas some doctors hold their patients out for as long as 4 weeks before they start PT. And again, to review some of our guidelines, we're allowed to go in a scaption plane, which is not quite flexion, not quite abduction, but we're allowed to stay here and lift the arm up to about 120 degrees, but we're gonna go below that for the first week. Other things we want to look at is sensation, any type of numbness or tingling down the arm. When they're in the sling all during the day, they get tightness through their trap, so they complain of tightness through here. We have to work on that. So again, the first day we go over is just kind of soft tissue work and isometrics, range of motion through the elbow, hand, squeezing isometrics through the hand to keep the distal part of our forearm strong. And I'm going to talk to one of my students, Charles. Anything that I not cover that you think it's important to kind of address? We went over incision.
Yeah, you talked about the incision. You talked about numbness in the hand. You talked about keeping the distal segment strong. You talked about not going into too much flexion.
Awesome.
I'm not sure if you mentioned limitations in external rotation that you have to look out for.
Yeah, we just reviewed that again. That's a good point. So again, external rotation, the doctor does not want to go beyond usually 10 degrees in external rotation or 10 degrees internal rotation. And we have to follow those precautions for about 4 to 5 weeks. 6 weeks they start to change. But again, we want to just kind of follow our guidelines. Make sure we appreciate the healing inflammation category of how things will kind of recover as we're going through the surgery. And we're going to go from there. But today we're going to do some soft tissue work. I like to keep a little bit of a towel underneath the elbow to prevent him falling into extension. I'm going to brace it with my leg so it doesn't fall off. Start with a basic cream. I'm not going over the incision. I'm going to go around and just start with some basic massage, go through the traps, and I'll show you some more techniques as we move along. You okay?
Yeah, ready?
Okay, yep, so gently just putting pressure down into the deltoid, and you're gonna internal rotation, isometric hold, good. Rotation, good. My fingers are on the back, rotation, good. And I'm just kind of swooping down into the shoulder. Any pain, Joe?
A little bit.
Okay. More soreness, you said?
Yeah.
Good. Push. Good, again, nice and gentle. Relax. That's one thing we can do. Now we can cradle the arm. Relax here, Joe. Keep him away from his body, but I have support. I'm gonna go in with my thumb gentle. There should be no skin burn. If there is, you're gonna let me know. Otherwise, my pressure's not good. So again, hands work together. A little bit of circumduction. My thumb is gently putting some pressure into the bicep laterally. Lateral part of my hand onto the medial part of his bicep. So people understand that a little better. Good. Gonna go in a little bit deeper towards the short head. Any pain, Joe?
No, just your finger.
Good. No burn, just pressure. Good. Up and down in the scaption plane, maintaining pressure. Back to circumduction. I'm grabbing, pushing down, and that's some there. Right, because all day long he's sitting in that sling with his arm held close to his body. Structures can become very tight through this area. Down. All our nerves that come through the brachial plexus can become entrapped and compressed. So we're going to work down through this area. You okay?
Yeah.
Since we're here, we can go into a nerve stretch. Joe, slide back to your right. Usually I use my leg, I'm going to use my arm. And I'm not really going to have too much compression. Joe, good there?
Yeah.
So I'm supporting his arm. Little rotation there. Then the wrist. So I'm looking for a stretch feeling into the forearm. Got it, Joe?
Yep.
No pain?
No.
Good. Keeping it very small movements. Turn the hand back up. Now let's go for a median nerve. You okay?
Yep.
Gentle compression. Fingers are open. Wrist up and down with me. I'll let him move so he has a little more control. He feels safer that way. Keep reaching up and down, Joe. Slow. How we doing?
I'm doing good, and you?
Good. And relax. Good. All right, so again, we're gonna go along up the trot. Got some tenderness through here. The first rib is elevated, as we can compare bilaterally. So you can go in. This is one way to glide the first rib. Through here. How we doing, Joe?
Okay.
So we can tilt our head towards. Some people are taught to do away. I like to go towards my hand. And ask Joe to take a deep breath in. Exhale.
Oh,
And thrust. And wow. Now we're just working a little bit of the muscles that come up to the base of the skull. Too hard, Joe?
no.
Good. Back. Make sure his breathing is hopefully in sync. Breathe in. Exhale. So remember, as we breathe in, stomach comes out. Exhale, stomach goes in. There you go, and exhale. Good.
Mike, how would this help him?
We're just careful and relax more when he's going through rehab. Be a little more mindful of his breathing, which is important in everything we do. Good. And if they're not using correctly, there's a little trick. There's like a primal reflex. Someone told me you can try it over the shirt, but it's actually just kind of flick. So Joe's gonna cough as I flick, so cough. And go again. Good, relax, that's a little trick. Good. Come back over, breathe in again. Exhale. Breathe in again. Exhale. Good.
Okay, press into it. What do we switch into next?
So we're gonna actually switch into an isometric internal rotation exercise. So all you're gonna do is you're just gonna take a step to the right. You're gonna put the towel on this side of the wall, and you're gonna try to push it forward.
Push the wall.
Yep. So you're gonna use a little bit of pec. Again, only about 50 to 60% contraction. We're gonna
5 seconds.
5-second hold, 15 times. And we're using the Neubie